I'm Yvonne Dunitz. Welcome to the Health View Special Edition. The Health View is dedicated to empowering you with information that will help you be informed, make positive choices, and be better advocates for your own health and well-being. Go to youtube.com and search for the Health View. Once you've put that in, the Health View comes up and you'll see a subscribe button. Please click on that button. This will help you to have free access to all of our shows. If you have any interesting topics that we haven't covered, or ideas or suggestions, please go to thehealthview@gmail.com. May we all be safe, may we all be healthy, may we all be happy, and may we all live with ease. I'm Yvonne Dunitz. Today is the April 7th, 2020 COVID-19 update. As of Tuesday, April 7th, there are 1.3 million COVID-19 cases globally, 715 cases in New Hampshire, and 69 cases in Nashua, New Hampshire. The Nashua Division of Public Health has recently launched an interactive COVID-19 webpage on our Greater Nashua Public Health Data Dashboard, hosted by Live Stories. This dashboard displays how Nashua is trending in New Hampshire with cases, testing, pending tests, and other data variables. We strongly believe that this tool will be a beneficial tool to our partners and community members in communicating case numbers and seeing trends within the state of New Hampshire. The COVID-19 data dashboard can be found at www.nashuanh.gov/COVID-19. The Nashua Division of Public Health is continuing to answer its hotline for residents to call to ask any health-related questions regarding COVID-19. The Nashua COVID-19 hotline is available 7 days a week from 8 a.m. to 9 p.m. If someone calls during off hours, they can leave a voicemail and someone will get back to them the next day. The number to call is 603-589-3456. The City of Nashua Division of Public Health, Office of Emergency Management, and School District continue to work with the state of New Hampshire, the New Hampshire National Guard, and our local hospitals and healthcare partners to set up an alternate care site, ACS, to assist in managing patients with COVID-19. The ACS is not open at this time and would only be activated in our local hospitals if they get close to our reach capacity. This will allow hospitals to conserve staff and resources to focus on the treatment of the most severe and critically ill patients. We hope to never have to use this facility, but we want to be prepared to help our hospitals and keep our community safe and healthy. The state of New Hampshire has possible temporary housing solutions for individuals who are members of the general public. To ensure the health and safety of our community, isolation and quarantine sites are available for individuals who are members of the general public who are able to provide for their own general needs. They will need a medical referral to access placement. These housing services can be arranged by contacting the following phone number at 603-415-1624 or filling out the referral form on www.nashuanh.gov COVID-19 and sent to gshcc@healthynh.org. COVID-19 can be spread from person to person before symptoms develop. The CDC and New Hampshire DHHS are now recommending that the general public use homemade masks in situations where they are unable to maintain social distancing in order to reduce the spread of the virus. There are two levels of face masks. Source control. Source control masks, example, are surgical masks and homemade face masks, such as cloth masks, bandanas, and scarves, are used by individuals to protect other people from their respiratory droplets. These masks should be worn by people that are sick or have respiratory symptoms, healthcare workers during their shift when not working with COVID-19 patients, and by people that have to do an essential activity and cannot maintain social distancing during that activity. Source control masks alone will not protect you from COVID-19 infection. Personal protective equipment, PPE, is used by healthcare workers to protect themselves from infection when conducting aerosol-generating procedures on a COVID-19 patient. The types of masks used for these procedures should be N95 respirators. Homemade masks are not personal protective equipment. These masks will not protect you from COVID-19, but they will protect others from your respiratory droplets. People wearing masks in public must continue to practice social distancing and hand washing to properly protect themselves from COVID-19. During the times when you are not able to maintain social distancing and you decide to wear a homemade face mask in public, practice the following tips to wear one safely. Continue to wash your hands frequently for at least 20 seconds. Continue social distancing and do not touch your eyes, nose, or mouth with unwashed hands. If you do not have access to soap and water, use hand sanitizer frequently. Take off and put on the homemade mask properly. Before putting on a mask, clean hands with alcohol-based hand rub or soap and water. Cover mouth and nose with mask and make sure there are no gaps between your face and the mask. Avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap and water. Replace the mask with a new one as soon as it is damp and do not reuse it. Single-use masks. To remove the mask, remove it from behind. Do not touch the front of the mask. Discard immediately in a closed bin. Clean hands with alcohol-based hand rub or soap and water. For more information and to learn how to properly don and take off masks, visit the World Health Organization, WHO. Wash your homemade mask between each use. Wash it with hot water with regular detergent and dry completely on a hot setting. To make your own face mask at home, visit the CDC. The most effective way to prevent the spread of COVID-19 is through social distancing and practicing proper personal hygiene. If you wish to do an essential activity and cannot maintain social distancing during that activity, a homemade mask will protect others from your respiratory droplets. If you are experiencing symptoms of respiratory illness, stay at home and contact your health provider. A PDF of this guideline can be found at www.nashuanh.gov/COVID-19. City officials will be hosting a press conference each Thursday at 2 p.m. to discuss our weekly COVID-19 update and response. These can be viewed live on the City of Nashua, New Hampshire Facebook page. The City of Nashua is seeking volunteers to assist with COVID-19 response. If you are interested in volunteering and are a medical professional, please call 603-589-4505. Your volunteer hours make a difference and will support the city in soft match for available federal grants. If you do volunteer, please complete our volunteer log to enter each location where you volunteered, the number of hours you volunteered, and the date that you volunteered. This log is available at www.nashuanh.gov/COVID-19. The Nashua School District continues to prepare bagged lunches and distribute at 10 of our schools and has expanded service to additional distribution sites delivered by the City of Nashua Transit System, Big Blue buses. Lunch menu includes ham or turkey sandwich, fruit, milk, and a cookie. Bagged lunches are available for curbside pickup at the main entrances of select Nashua schools from 11 a.m. to 2 p.m. Mondays, Wednesdays, and Fridays. The full schedule can be found on the Nashua School District website at www.nashua.edu. Nashua Transit Systems continues to operate an on-call van service for Nashua residents needing access to essential services, including grocery stores, pharmacies, medical needs, and essential jobs. This is a shared ride service which picks up passengers at their origin and takes them to their destination within Nashua city limits. Service will be available for pickups between 6:30 a.m. to 6 p.m. Monday, Friday, and 10 a.m. to 6 p.m. on Saturdays. Nashua Transit System will adjust service times as demand warrants. The fare for on-call van service is $1.25 each way. Please call 603-880-0100 extension 1, Monday through Friday, 6:30 a.m. to 6 p.m., with as much advance notice as possible to schedule your trip. If you are not sure if your trip qualifies for any other questions, please contact us. The City of Nashua continues to encourage residents to stay at home unless they need to go out for essential needs, essential job, groceries, medications, medical supplies, caring for a loved one. If residents do not have to leave their homes for essential needs, we are encouraging them to practice social distancing and good hand hygiene by keeping at least 6 feet away from others at all times and washing their hands often. It is okay to spend time outdoors if you are not in a group. Social distancing can be practiced by continuing to live your daily life while creating distance between yourself and others and avoiding large gatherings of more than 10 people. It is our social responsibility to keep our community healthy and safe. If we work together to stay at home, practice good hygiene, and avoid close contact with others, we can slow the spread of COVID-19. We continue to recommend our community to prevent the spread of COVID-19 and other respiratory illnesses by the following. Cover your mouth and nose when coughing and sneezing. Stay home unless you need to travel for essential needs, groceries, medications, medical supplies, caring for a loved one, or an essential job. Wash your hands often for at least 20 seconds. Do not touch your eyes, nose, and mouth with unwashed hands. Practice social distancing by avoiding crowds with 10 people or more and maintaining a distance of 6 feet from others. Clean and disinfect objects and surfaces using standard cleaning products according to the product's manufacturer's label. Surfaces should be allowed to air dry. May we all be safe. May we all be healthy. May we all be happy. And may we all live with ease.